Good afternoon. My name is Madison Ward. Today I have set up a hypothetical health insurance plan that I would be eligible for, and I'm going to compare it to the costs of getting a C-section in Indiana. So, when I was signing up for my hypothetical one, I would like to point out I am currently on my parents' health insurance through them, but for the sake of the assignment and setting up my own hypothetical one, I put in all of my demographic data about my sex, my age, and within the job that I currently have, I know that you are eligible there. If you work enough hours, you can be eligible to get health insurance through them. I don't exactly know what their health insurance like entails or what the deductibles, copays, premiums, anything like that is going to be for there. So while I did click that I can get it through my job, I'm assuming that that is going to affect the price because I'm still looking at the healthcare plans that were available on this website. So the one that I clicked, I just chose to go with the one with the smallest monthly payment, and that was still $303.15, which I find to be extremely high to expect a 22-year-old to pay per month. But the deductible is going to be $10,000 or $10,600, and that includes health and drug. There can be more deductibles that would apply to certain procedures or services that you would need. And then that same price right here is also going to be the out of pocket maximum. And that was just for this health insurance plan also only covers in-network medical providers. If you go through here, it has a 2-star rating, so I'm assuming that is not great. We can click on costs for medical care. There are 2 network tiers that you can go through. Network tier 1 is going to be the primary one, and as I go through a lot of these other little drop down menus, you're going to see that in network tier 2, certain things don't apply. I believe prescription medicine was one of those. And once again, anything out of network is not going to be able to get. So, like, yeah, prescription drug coverages, we get no charge after the deductible. However, in the tier 2 network, it doesn't apply. So, you won't be able to get anything through there. There is no dental coverage within this whatsoever. But, so when I go over to Fair Health Consumer and I looked up the price of a C-section, in total, out of network, it would be $49,000, but in network, it would be $16,641. And then the Medicare price would be $6,673, which obviously I'm not doing the Medicare plan, but I did like seeing that number. And then this is going to just detail some of the additional costs in it. So those are the 2 totals. And then you have a bunch of listed things here like anesthesia, just supplies and stuff that you would need, tests, medical tests and exams, radiology procedures, and then the actual surgery itself. Those were additional things. So in total, the out of network or uninsured price was going to be $60,000, but the in network price would be $22,000, which overall, obviously, that is a huge difference, and it would be great to get that much removed from that total price. However, in my hypothetical situation, if I am having to pay $303 per month and I still have to pay $22,000 after that, I find that to be very high. Obviously, I picked probably the worst coverage that was available since it was the lowest deductible. But regardless, I find that to be really honestly extremely crazy, and at that point, it puts me in a better perspective to understand like how certain people have to deal with finances like this. And honestly, if I were living in this situation, I would probably try to avoid doctors at all costs, if I'm being completely honest, because I would not want to have to pay these crazy prices, especially with the $10,000 deductible. I know for myself right now, I don't have $10,000 saved to pay that. And also, I know that there's like a large statistic of adults within the United States that do not have $10,000 saved for emergencies. Overall, I think that is still an extremely high price. I mean, like I stated before, it's great that we're able to get that much off already. However, I still feel that that is a pretty ridiculous price that not a lot of people are going to be able to pay, especially if you already can't afford better health insurance. I think that is an issue that is really going to need detailed. I don't have it pulled up, but before I went through the C-section costs, I was looking at ambulance costs, and that was also still pretty ridiculous. I made sure to click on the option where include an ambulance that just you needed like superficial treatment, I guess, like band-aids, maybe like a little bit of stitches, stuff like that. And it was still like, I want to say $4,000. I ended up choosing this one though because it went into a lot more detail. But yeah, overall, I really think that it is unfortunate that we get offered health insurance and such, but we're putting in so much money per month, which is already a huge chunk of like my income. So I put the expected income for the year to be $31,000 because that's what my recent tax form had for my last year's income. And then so that's about $2,000 per month, a little bit more. And then for 300 of that to already be going to a health insurance premium that I may or may not use, I understand why a lot of people just remain uninsured overall. Thank you for listening.